Good evening and welcome to Kansas City Alive, the weeknight video magazine here on ACKC. I'm Kevin Kaish, your host for tonight's show, and it looks like another good one. On Family Focus tonight, Madeline Lauder will talk with her guest from the National Council on Alcoholism about adult children alcoholics and alcoholism. Erwin K. Roberts is here with a review of the films Angel Heart and Lethal Weapon. Cindy Winsky and David Gibney will give us the latest on news, weather, and sports. And Barbara Christ is here with another segment of commentary on Barb's Barb. We'll also look at tonight at the proper use of prescription medicines on a feature titled A Dose of Common Sense. But first is Dr. Charles Scott with his weekly segment, Medically Speaking. Tonight's guest is Dr. Buford Casebolt with information on family dentistry. Dr. Scott?
Good evening, I'm Dr. Charles Scott. My guest tonight is a very good friend of mine. I consider him a Renaissance man. He doesn't know that, but he does many things. He's a director of a hit television show. He makes fine music videos. He is a marvelous composer, but most of all, he is a fine dentist. And he's going to talk to us tonight a lot about and show us a beautiful video. Tell us about dental attitudes tonight.
Well, first of all, it's a pleasure to be here, Dr. Scott. I feel that dental attitudes are probably the single most important thing involved in preventive dentistry. Preventive dentistry, as most of us know, has to do with preventing dental disease. However, the success of this has a lot to do with the individual's attitudes. I thought to illustrate this more explicitly, we would create a fictitious patient, and by no means is this an average patient, but it would be characteristic of a patient that would be somewhat neglectful. And I do have an aid here that we can look at. This is a typical dental chart that one might find at a typical dental office. As you can see, the teeth are numbered 1 through 16 on the top row and 32 through 17 on the bottom row, and this has to do with the upper and lower teeth. Again, this is a standard chart. Our fictitious patient began his dental treatment at an early age, but not quite early enough. In this illustration, we show an 8-year-old that has presented to the dental office with rampant caries. Unfortunately, at the time, the proper care was not instigated previous to the appointment, and to make matters worse, extractions were instigated without proper control of the space.
Just tell us what caries is.
Well, this has to do with tooth decay. Tooth decay is the destruction of the surface of the tooth, resulting in bacterial invasion, microbes.
And the red on the chart indicates where the decay is, right?
Exactly.
Okay.
The teeth that you see here and here, in these areas, this area and this area, are baby teeth. The unfortunate aspect of this treatment was that management of the space was not instigated after the extractions, and as a result, the permanent teeth began to move forward. At this point, the damage to the permanent teeth were relatively minimal, but unfortunately, at a subsequent visit, which in this case would be about when the patient's 13, there is not enough room for the permanent teeth to come into place because of movement of the permanent teeth into the space where the premolars would in fact erupt. As a result of that and further neglect, the decay process does in fact worsen. At a later age, abscessing develops in some of the lower teeth, and the patient is given an option whether the teeth are to be saved or extracted. Unfortunately, due to poor dental attitude, the teeth are in fact extracted as opposed to having root canal therapy, endodontics, and saving the teeth. As we see in this illustration, the teeth are now missing, and these were the first permanent molars. This is a very, very unfortunate loss. But unfortunately, the neglect does, in fact, continue through the years. And as you can see, there's more and more red areas indicating more and more decay. Tooth decay increases at an accelerated rate as the damage becomes worse. We can see in subsequent years, now we're looking at about a 26-year-old individual, the red marks have become greater. The visit here is instigated by a chief complaint of pain. Again, more teeth will require extraction or root canal therapy, but again, unfortunately, the patient has opted for further extractions. As time moves on and the patient begins to see their middle ages, the destruction becomes quite a bit worse, involving fracture of remaining tooth structure and basically gum disease, which is the big dread in dentistry, begins to take its toll. And again, the years go by and the damage becomes worse. Eventually, the patient is suggested that they consider full dentures. And unfortunately, this is the sequel of this whole process. It's an unfortunate situation to look at, but I think probably the important thing to consider, and the point of all of this, is that there is a better way, and it doesn't necessarily have to be this way.
Well, this is a hypothetical case, but not unlike many that you see, I'm sure.
I would say it would be typical of the neglectful patient.
Is this the patient's neglect primarily, or was the dentist negligent in any way?
Well, it depends upon the situation. In some cases, there can be neglect on the part of the practitioner if they do not properly advise the patient.
Like doing an extraction instead of trying to preserve the teeth.
Exactly.
Well, that's very fascinating. I think you have something that's even more fascinating. It's kind of a specialized interest of yours that I'd like to show. Well, to be sure we get it in. It's a beautiful video that Dr. Casebolt has done, indicating some cosmetic dentistry procedures.
Yes.
We'll see that right now, and I think you'll find it.
I would also like to make one other interesting point. In the procedures that you will see, the procedures were done without a local anesthetic. They were quite comfortable for the patient during the time that the procedure was done. The results were extremely cosmetic, and I guess the point of all of this is that dentistry does not have to be a negative, uncomfortable, painful, expensive process. It can be a very comfortable, very economical, and very long-lasting process, a very positive thing, and this is what I would like the people at home to see in this video.
Well, we'll see the video now.
With this procedure, we will see the process of direct bonding. The composite material which will be bonded onto the tooth will be custom shaded and shaped to enhance the appearance and natural contours of the teeth.
First, a shade is selected from our kit which will most accurately complement the teeth. The remaining fragments of old fillings are removed. After the old filling is removed, the outer surface of the teeth are polished clean. This will help ensure a strong restoration. Clear plastic strips are placed between the teeth to protect the adjacent teeth. An etchant gel is applied. This, in effect, increases the surface bonding area 1,000 times. This is responsible for the great strength of this restoration. After a few minutes, the etchant is rinsed away. The teeth are now completely dried. Note the frosted appearance of the teeth. This is the effect of the etchant gel. After the teeth are thoroughly dried, our first layer of bonding resin is now placed. A special light activates the resin and causes it to set. A heavier, filled composite plastic material is now placed. This material is responsible for the bulk strength and natural appearance of our restorations. After our material has set, the teeth are contoured for a natural appearance and function. A strip of carbon paper is used to measure the patient's bite. Further adjustments are now made. The process you have just seen provides a durable and long-lasting restoration, one that the patient can be proud of. Now, let's see an extension of this process.
Well, that was a remarkable video. I
Thank
think what we need now for our viewers, because our time is almost up, is a summary of what you've really tried to do in this segment. Dental attitudes.
I think dental attitudes are extremely important. There have been so many changes in dentistry over the last decade. It's not a painful, uncomfortable, expensive, negative experience. It's very positive results, relatively economical, I might add also. And this is the point I want to stress to the public, that there is a better way other than extracting and losing teeth.
Thank you very much for coming, Dr. Casebolt. Dr. Buford Casebolt, dentist, Renaissance man. Stay tuned for more Kansas City Alive.